Good morning and welcome to Ask the Expert on 58 WCHS, the voice of Charleston. Dale Cooper is usually here on Friday morning, but he's beginning his vacation, so this is Dave Harmon filling in for him today. Today we're going to talk with Dr. Jeannie K. Bailey, and we have several things to talk about. And first of all, good morning, Doctor. How are you?
Good morning, Dave.
Good.
How are you today?
Well, it's a little warm for me out there. Some people like it, but I'm more a fan of the lower humidity. I don't know about
we're
you.
having a little bit of problem over at the fair. I'm at the Putnam County Fair with the animals, and they're having a little bit of a heat stroke over there.
Now that's like your other job, isn't it? Working with you're what, a commercial grain farmer?
Yes, we agriculture, but the big thing this week has been the Putnam County Fair, and I have a 14-year-old and a 16-year-old that show cattles for 4-H, and they both won Grand Champion Reserve, which that's second place, and that's really big. And I'd like to invite everyone. Tonight is our buyer's sale, so if you want to come and support the 4-H and the FFA children, tonight is our big auction.
Is this the first time that have you been involved with them for several years, or is this the first time for you? Or
no, this is several years.
Several years?
I was in 4-H when I was young, and so was my husband, and so both of my children have been in.
Putnam County?
Yes.
Excellent.
It's big business for us at this time of year.
Well, Dr. Bailey's here this morning, and, of course, your phone calls will be welcome if you have questions during our show. You can call us up here, and our phone lines are open right now at 304-345-5858. That's 345-5858. Dr. Jeannie K. Bailey, is your office over in Putnam County as well? Yes,
I'm right across from CAMC.
Okay. And I'll give you this phone number now for the office, but we'll repeat it again later if you don't get it right now. It's 757-7428. Now, our subject this morning that we want to talk a little bit, TMJ and some of the things related to that, correct?
Yes. We'll talk about TMJ dysfunction.
Okay. Well, what is TMJ to start with? We hear a lot about it, but I'm not exactly sure what it is.
Well, most people use the terminology, I have TMJ. So just for clarification, everybody has TMJ because that is your jaw joint. And it's on the right side and the left side of your mandible, your jaw, and it's the only bilateral hinging bone in the body. So it has two sides. So it's kind of unique.
So we can move it sideways and up and down.
Yes. So anytime you hear someone say, I have TMJ, all you have to do is say, I have one too. It's the dysfunction that we're going to talk about today.
So, yeah, I never really hear that. What is that called? TMD?
TMD.
Okay. So in TMJ with your jaw, I imagine since everything that supports your body goes past your jaw at some point, it's pretty important. Is that pretty important why it keeps to stay healthy?
Yes, and you have to think about it. If you have a broken arm or a broken leg, we typically put it in a cast and you can immobilize it. But when you think about the jaw joint, it's a little bit different in nature because you need it to communicate. You need it for speech. It has to move around. You need it for eating. So if it is having a problem, it's one of those frequently moved hinges on both sides that it makes life very difficult. And it also is great for smiling,
Well, yeah, it would be important for that. You see these guys on the TV shows singing and stuff like that, and I see them moving their jaws around a lot on that. Does moving your jaw a lot like that cause that kind of dysfunction?
No, not unless you have a problem. See, there's a little disc on both sides, like you have a disc in your knee, and then there's ligaments holding it in place. So most often what happens is if you have a problem with a ligament that would tear or a disc that would move out of place, that throws an imbalance in the system. Some people pop, some people click. And, with singers, this is a big problem. And I treat singers all the time. And it's life-changing, because sometimes your mouth won't open straight, and it really affects your high notes, but because it affects all the nerves and the muscles for singers.
The signs and symptoms of jaw joint dysfunction, and that's how you have this written down so that we know exactly the difference. We don't just call it TMD or TMJ as we've discussed, because we know everyone has one of those. But how do you know that something's going wrong back there?
Well, there's the pop and the click. That's the red sign, you know. Most people, they click and pop when they open or move their jaw around. But some of the side effects that most people don't realize is headache. If you have a headache, and some people say, oh, I have a migraine, or oh, I have chronic headaches. Well, sometimes it is the TMJ dysfunction that's causing the headache. It's not actually a migraine. You can have neck ache, and you can have dizziness. Dizziness is very, very common when the jaw is not in the correct position, or dislocated is a good term. And ringing on the ears, you will have this tinnitus, you know, where it just buzzes and rings, because if you put your finger on your jaw joint, how close is it to your ear hole? So it does affect your hearing. So if it's dysfunctioning, a lot of people have ringing in their ear. And there's a lot of other things that go with it. Sleep apnea is a big one. So there's a big connection between the two.
How do you get sleep apnea from a jaw joint dysfunction?
Well, you don't get sleep apnea from a jaw joint dysfunction, but what you do get is when you have sleep apnea, and just as a refresher for people who've listened before and people who haven't, you know, sleep apnea is where you actually stop breathing for 10 seconds or more while you're asleep. So people who stop breathing, one of the common things they do is grit or grind their teeth. That's called bruxing. You know, in the Bible, it's called gnashing of teeth. And when they're doing that, they're trying to open up the airway, the body's self-defense mechanism. And I always say the body wants to live. You know, they will grind their teeth because they want to breathe. So there's a connection. About 40% of all TMD or jaw joint patients who have dysfunction are sleep apnea patients. So I always have to look at the whole package.
How does one know that's sleep apnea? It wouldn't surprise me if a lot of people don't even understand what's going on with them.
Well, with sleep apnea, if you're lucky enough to have a bed partner or someone around you, they'll hear you snore a lot, and then they will gasp, or they will stop breathing, and someone will hear it. Now, sometimes the person who has sleep apnea doesn't even know they have it because they sleep right through it. But, you know, they struggle to breathe. They will wake up choking sometimes, and that's an indication if you don't have a bed partner. Or you have the acid reflux goes along with it. So there are warning signs for people who are single and live alone. But, you know, if you do have a bed partner, they hear you choke or just stop breathing.
How does the reflux go along with that? I because I'm not familiar with it, I don't see the connection.
This is the first time Dave and I have worked together. So, Dave,
it is. So forgive us a little bit. I'm trying really, really hard with Dr. Serber here this morning, and I'm sorry, Dr. Bailey here this morning. Yeah, that's a bad one. Dr. Jeannie K. Bailey here this morning talking about this. How do you get? Let's just move to this. The
reflux.
The reflux.
Right.
Yes.
See what happens when you stop breathing at night. It's another CPR move. So the body wants to live, and the bottom of the lung is called the diaphragm, and that's the muscle that makes your lung breathe. So what happens is that muscle will contract, and if you have acid in your stomach, as you give it that, it pushes the acid up into your esophagus. So sleep apnea patients often have acid reflux. It pushes the acid up because there's that contraction of the diaphragm.
That is very interesting. I had no idea about that those two could go together. I always thought it was just eating too much or eating at the wrong times or something like that. We have open phone lines right now, and the number is 345-5858 if maybe you are having some of these issues, or maybe now that you've heard about them, you think you might be having them, and we can take your call. Dr. Bailey, when we come back, I would like to delve into a little bit about what causes TMJ dysfunction, what starts that, how people get in a bad way with that to begin with. 345-5858 is our phone number to call Dr. Jeannie K. Bailey, 757-669-3663. 7428. It's that phone number. It's 304-757-7428. And that'll put you through to the offices of Dr. Jeannie K. Bailey. We'll be back after this on 58 WCHS, the voice of Charleston.
News happens anywhere, around the clock. Charleston's only 24-hour radio newsroom is 58 WCHS.
How many times have you said, "That's not right, I think I'll sue"? But do you really have a case? The easy way to find out is to call the Peyton Law Firm. With just a phone call explaining your problem, Harvey or Tom can tell you in minutes if it's worth pursuing. And there's no charge. If you don't know the law, trust the Peyton Law Firm to explain what your rights are and how to continue. The Peyton Law Firm, 304-755-5556. That's 304-755-5556. Or online at PeytonLawFirm.com.
To win the A6 World Series of Beach Volleyball, you need to dig deep. That's because this official FIVB event is set to test the best players in the world, like me, Carrie Walsh Jennings. So come root for us July 22nd through the 28th in Long Beach, as we compete to bring the coveted World Series Cup home for the USA. Enjoy free admission, world-class bands, DJs, and more. The A6 World Series of Beach Volleyball is sure to give you a spike in adrenaline. Visit WSOBV.com for more details.
18 holes and a cart for $20.
You can't be serious. 18 holes and a cart for $20?
Where? At the mini golf?
Sandy Bray's weekday special. 18 holes of golf on their impeccable greens, plus a cart. Only $20 every Monday through Friday starting at 3 p.m.
I'm taking clients this week.
I'm taking my kids.
Sandy Bray Golf Course. Home of the best greens, fabulous hot dogs, and the $20 weekday special. Sandy Bray Golf Course at the Emma exit off I-79.
Frank the Frontier Buffalo here. With Frontier's hot deal on high-speed internet, I'm staying cool. That's good, because I'm not built for pool parties. When I do a cannonball, they have to refill the pool.
Call 1-888-FRONTIER. Switch to Frontier high-speed internet. Just $19.99 per month with qualifying phone service guaranteed for 2 years. Plus, free internet activation and a free Wi-Fi router. No contracts and no early termination fees. You can't get BS from a Buffalo. Call 1-888-FRONTIER. Limited time offer. Service subject to availability. Actual speeds may vary. Taxes, surcharges, and other restrictions apply. Call for details.
Line drive into right field, and that is an RBI base hit. Rounding first base, heading on to second. That's a double for Matos.
And he'll swing and lift this ball to left field, carrying to the wall. That's a home run for Shin-Soo Choo. His 13th of the year. There's a base hit into right center by Frazier. Phillips will score. Been a 3-run ninth for Cincinnati, and it is now 8-3 Reds.
Your home for Reds baseball, 58 WCHS.
Back once again on Ask the Expert from 58 WCHS, the voice of Charleston. Today's expert is Dr. Jeannie K. Bailey. Dr. Bailey has an office in Putnam County, and that phone number to reach her directly is 757-7428. That's 304-757-7428 for Dr. Jeannie K. Bailey.
And I always have to say, I am not an expert. I am a general dentist, and I just have special interest in the area of sleep and TMD. So I always say that on every show.
Okay, good. We've been talking about the jaw joint dysfunction. Some people call it TMJ, but it's actually a dysfunction of TMJ, as we established. So how does this all get started? What are the causes of that dysfunction?
Well, sometimes it starts in utero or when the baby's inside the mother's belly, and you kind of have to visualize this as we're going along. When the baby is inside, it's kind of squished. You know, that's a lot of baby in a small space, and sometimes the neck is malpositioned, and it's in there for 9 months, all crooked. So when the baby is born, it comes out. It just doesn't sometimes all the way stretch out. And I'm sure a lot of mothers and fathers know when their child was born, they say, geez, the head is not exactly straight. So sometimes when the baby is born, that needs corrected at birth. So that's one way it would start. And then another way it would start is very, very common, and I'm sure parents can relate to this or anyone who's had it happen, is trauma. You know, if a small child falls And how many people do you know had to go to the ER and have their chin sewed up underneath, and they have that little scar underneath their chin? So if they fall at a very early age, like 1, 2, 5, whatever, when you hit on the chin, that really traumatizes the TMJ joint, the muscles and the nerves around it. So any kind of trauma, whiplash with a car accident, or in my case where I got thrown off of a horse and landed on my jaw. So, that's another way to do it.
Are there any other causes?
Sure. Stress is a big one. A lot of people in today's society, they have stress, they clench their teeth, they get the tension type headaches. Stress, at tax time, I always have a lot of people call around tax time where they're having problems. Or the people who clench and grind from the sleep apnea, that's another cause. And poor posture, which relates back to some kind of trauma, or at birth, someone's in the wrong position. And then you have to look at the foods that we're eating. Our diet has changed so much as we go. Now we have Big Macs, so when you have these supersized subs or the bigger bites that you have to take, you have to over-open, you have to squish it down to get it in. That can cause problems.
When we were talking a couple moments ago, you mentioned that teeth grinding thing. I imagine that's where it all comes from with the stress, right?
Yes, tooth grinding can also be caused by a couple other things, not only sleep apnea, but it can be caused by your teeth not coming together properly. So I always say if you can't find a good home, you're going to grind one. So people who are looking for a good place to put their teeth, if they're out of balance and they need braces, if they can't find it, they're going to grind it. And also frequently people who I hate to say abuse substances, as in drugs or alcohol, they have a tendency to grind their teeth.
How is that? What do they do to them?
Particularly meth cases, that's a side effect. They have a tendency to grind. That's a side effect of medications. Not just that, but other medications.
I see. Dr. Jeannie K. Bailey is with us here this morning, and Dr. Bailey's phone number is 757-7428 for her offices if you want to be on the show. Our phone lines are open at 304-345-5858. Now, we talk about the causes of TMJ dysfunction. Let's move on to we discussed this a little earlier about the sleep apnea, and I'm a little confused here. Do TMD patients have sleep apnea? Does the sleep apnea cause the jaw dysfunction, or does the jaw dysfunction cause the sleep apnea? Just to clear it up.
Well, that's almost, is it chicken come first or does the egg come first? So, it all depends. Usually, TMD patients, about 40% of them are going to have sleep apnea. And those are the grit grind people trying to open up their airway. And I can't tell you which one comes first. It's based on the individual patient.
Well, how do you diagnose TMD? Who can do that?
Well, most patients who come to me, sometimes they have their jaw locked open. Ooh. That's a rarity. But when it's very grotesque, but they can't make it close. And then that's a pretty easy one to diagnose. When they come in, you go, whoa. And then I have some people who can't open their mouth. When that piece of cartilage dislocates, they can't open. They have a very limited opening. And one of the common things that they say is, I can't eat a hot dog anymore. So they can't open. Patients come to me and say, I pop, I click. And I'm sure you've had dinner with someone across the table and you've listened to them rattle around, where they pop and click when they eat. So that's one of the signs and symptoms diagnosing. But the most frequent thing when people come to me, it is usually headache pain or facial pain. And those are the ones that really need the help.
Do they have just regular headaches or what they call migraines or anything special?
Yes. See, there's a muscle type of headache, where the muscles are pinching nerves and it's very tight. The muscles go into a spasm, and then a migraine. So it's very important for me to kind of look and see, because quite a few patients are misdiagnosed for migraine when it's actually a musculoskeletal problem. The muscles and the bones, when I say musculoskeletal, it's the muscles and the bones aren't working properly.
That's a kind of an interesting concept. I've gone through that migraine stuff before, and they looked at just about everything they could from the medical standpoint, and they never thought about, so far as I know, no one ever mentioned to me about thinking about TMD being a cause.
Well, a good example is I had a sweet lady in yesterday. She's been to 2 neurologists, and they thought she had a stroke. They thought it was migraines. And within 10 minutes, I put a little temporary mouthpiece in, and it went away.
So is that when you're treating TMD in your office, that's one of the things that you must do? What are other things that you do to treat TMD?
Well, in my diagnosis, back to the diagnosis part,
Okay.
I have a lot of special equipment that I use. I have a jaw tracking computer. It is very cool because we put a magnet on the jaw and then it's tracked with a fancy computer, and it will actually show me where the jaw moves, at what millimeter does it pop, and it also shows me muscle tension. If a muscle's in spasm, is it a temple muscle? Is it a masseter? The one main muscle that closes your jaw is the fat weightlifter on the side. Those are called masseter muscle. So I have special equipment that will look, and it'll also record the sounds. So I'll know the decibel level of where it pops and when it pops.
Dr. Bailey, we have a caller on the line. Can we go ahead and take that call now?
Oh, that would be great.
It's Ken from Charleston. Hi, Ken.
Oh, hi. I had a question for the doctor concerning sleep apnea. I have true sleep apnea, like we have small air passages and the back of your throat collapses. I have to use a CPAP machine. I've heard your commercials about being fitted with a mouthpiece. Can you use those to eliminate the CPAP machine, or is each case different?
Ken, each case is different, but in lots of my cases, I use the oral appliance, and of course I always do home sleep testing to make sure that it's working and we're reducing your apnea events, and it works well for lots of patients. And then some patients, Ken, I don't know how severe you are, but we do a combination therapy where you wear the mouthpiece and then the CPAP, and that way the pressure's not so high. Are you a severe sleep apnea patient, Ken?
No, I would say moderate to low.
Well, the American Academy of Sleep Medicine recommends an oral appliance for mild to moderate sleep apnea. So it's one thing that is very nice, especially if people have to travel a lot or camp. And then my claustrophobic patients, it's a very good option.
Okay, I just didn't know how dangerous it could be. I just had a sleep study, so I'll have a better understanding. Maybe I'll contact your office and see, if it'll be right for me or not.
That'd be good, Ken. And, Kelly, she's my front desk lady there. She will send you information so you can read up on it. And you're welcome to visit my website, which is westvirginiasmileartist.com. It has a little explanation on there about sleep apnea and an oral appliance. So love to help you out if I could.
Okay, thank you very much.
Oh, thanks for calling, Ken. Appreciate it.
Thanks for your call, Ken. And I might mention, Dr. Bailey, that on the front page of this www.wvsmileartist.com, you have links to 2 questionnaires.
Yes, it has an Epworth sleepiness scale, because with the Epworth sleepiness scale, that's kind of like actually what insurance companies looks at. But it tells me how sleepy you are. So it's an indicator. It doesn't diagnose, but it's an indicator of, do you have sleep apnea?
So on the webpage, we have a sleep questionnaire, we have a TMD questionnaire, and also Dr. Jeannie K. Bailey's phone number, which is 304-757-7428. That's 304-757-7428. That area code thing still throws me.
I know.
But now the beginning of that. Okay, we have 9:35 on Ask the Expert with Dr. Jeannie K. Bailey, and I think where we were talking about who can diagnose TMD and how you treat TMD. We took the phone calls. So can we go from there?
Sure.
How do you treat it? How do you treat it? When you go to the office, what do you do for people?
Well, let me go back to who can diagnose, and then we'll go up to the treatment part, because, who can diagnose it? Any physician can diagnose it. Some people can self-diagnose if you're popping and clicking. But any physician can diagnose it, and if it is popping and clicking, medication will not help that. So if someone writes you a prescription for some pain medication, like if you have a headache, then you need to look a little bit further. And actually, the only people who can step into the mouth and make an appliance or a splint is the dentist. And any dentist can treat this. When I mentioned that I'm a general dentist, I just have special interest in this, and this is the area that I love to study. So any dentist can do it, but you kind of have to know how to handle special patients. Now, remember when I was talking about a broken arm or a broken leg, you put a cast on it? Well, we kind of do the same thing with the jaw. It's called a splint or an orthotic, and it's a little piece of plastic that fits over the teeth, custom made, and what it's doing is trying to relocate that jaw joint. And it also calms the muscles down and the nerves where you're having spasm. So any dentist can treat this, but you kind of have to know, a little bit of special interest in this area.
Let me ask before you move on from the splint. Is that something special? Does it really hold the jaw tight, like, say, your splint in your arm, or does it allow for some movement?
These never wire your jaw shut. We only do that when you have a fracture. And you can move, you can talk, you can eat, you can sing. Some of my singers, they sing with their splint in. Now, in the beginning, you have to learn how to talk around it a little bit. But it actually is just like you're going to wear your arm brace. It custom fits over the teeth. And it's very comfortable. I wore one for 12 months, so I didn't have major problems, and patients couldn't tell when I had it in.
So does it help you relax when you're not talking and doing all these things and those muscles back there?
Yes, and if you're having that chronic daily headache or migraine symptoms, I'm out to reduce that if at all possible. If it's the connection with the TMD and the headache, patients will wear it comfortably so they don't have to have a headache.
345-5858 is our phone number, 304-345-5858. Are there other ways you can treat TMD in your office, Dr. Bailey?
Sure. Medication, I am not a big, and I hate to say the word pill pusher, but I don't write a lot of prescriptions. But when we have severe patients come in, sometimes you have to use a pain medication or a muscle relaxer, because we have whiplash cases and some dislocated patients which they're in acute discomfort. So, we do use medications when needed.
Well, I would imagine that medication, just anything that's strong enough to abuse, can certainly be of use when prescribed properly for the right people, huh?
Yes.
Let's see. Exercises. Is that another way? Because, whenever you mess your back up, and forgive me for comparing this to something that really doesn't have anything to do with your mouth, but whenever, say, you mess your back up, which I'm familiar with, you need to rest it somehow, but then you need to exercise it or everything just slips back to where it was before.
When I treat TMD patients, I always like them to go to a massage therapist, a chiropractor, or a physical therapist, because I'm really good at treating from above the neck. But sometimes there's a connection, especially I'll always ask my patients who have TMD, does your lower back hurt? And they say yes. Well, I know I can't get them better unless we get the spasms out of the lower back. So it's kind of like, you remember that song that we used to sing, the toe bones connect to the foot, but, it goes all the way up? Well, I just do it real quick. When my patients come in, I always say the toe bone's connected to the head bone. So I always sing that little song to them, because you have to fix everything in between.
We're with Ask the Expert. Dr. Jeannie K. Bailey's here, and her phone number is 757-7428 in the office. Any other ways of treating TMD in the office?
Yes, and we do prescribe exercises when we do it. I have a little helicopter thing that they use with their teeth. Not only that, we use TENS and we use ultrasound.
What's TENS?
Well, it's an electrical machine. That's the one that will actually cause the muscle to kind of contract and then relax and contract and relax. So many people know that when they've had a lower back problem or they go to a physical therapist, TENS is a very common thing used. So it's outstanding for TMJ. We use it on the TMJ and the neck to alleviate muscle spasms.
So it sounds like that this is interconnected with your body in a way I never expected a jaw to be.
Oh, major interconnection. So when I look, I never look at just the jaw joint. You know, it's the head bone to the toe bone connected.
So, splints or oral appliances you mentioned. You mentioned medication, exercises, the TENS. Anything else?
Well, sometimes after we get people comfortable with the little splint in their mouth, all of a sudden they can't go without the splint. Now, I can wean people off of a splint sometimes, which is wonderful. And on the average, people wear a splint, depending on how sick that their jaw joint is, for 6 to 12 months. Then we have to decide, is there a phase 2 treatment, or can you wean them off? Now, some people I can wean off and they just sleep with it at night. Other people, they can't do without it, and you have to reconstruct the bite, which is do braces to make their back teeth taller, or actually crown the teeth to make the teeth taller.
I'm going to throw a question in here, so don't kill me. But I'm very curious about this. When do people start? What age do people start realizing that there's a problem here, and you start seeing them generally? Are they kids? Are they grown-ups?
I start looking at children, from the time they come in. I like to look at 1 year of age. And then if I see a problem starting then, I always forewarn parents, this is a possibility coming down the road, but earlier is better in the treatment of this.
It must be difficult with children, though, because they just don't have any of this knowledge yet. It would seem they'd have a real hard time telling you.
Yeah, and then, again, it's like the child that falls on their chin. We're continuously watching them to see if anything's changing. So you have to watch children up.
Now, how expensive is these kind of treatments? Is this something we can rely on insurance to help with?
Well, anything that I do as far as sleep apnea or TMD is a major medical. This is not dental related for me. This is all billed to a major medical company, because this is not considered dental in nature. At least in my practice, it's a major medical, and most major medicals cover TMD dysfunction and sleep apnea.
That's really interesting. I never thought of it as a medical thing. We get a lot of different things to do with the teeth that are all dental. As we know, when we go to the dentist from the radio station here, sometimes we're looking at different confusing. We have a whole separate plan for dental, as a matter of fact, but we can go on to that. Well, we're going to take a break here and take some of your calls if you would like. This is a great time to call because we still have enough left in the show that you'll be able to have time to ask your question in a relaxed manner. And right now we can get you on the air immediately after the break. If you give us a call at 304-345-5858. That's 345-5858, and our producer Anthony will line up your call and get you ready to go on the air with Dr. Jeannie K. Bailey. And if you want to contact Jeannie K. Bailey's office, call 757-7428. That's 304-757-7428. If that puts you into long-distance territory, there's a toll-free number, 877-757-7428. We'll be back after this on 58 WCHS, the voice of Charleston.
News happens 24/7. Find out what happened overnight with Jim Bohannon and America in the Morning. Weekday mornings at 5 on 58 WCHS.
Remember when a trip to the bank meant getting a lollipop reward just because you walked in with Mom? At MVB Bank, we want you to feel that stress-free again. We're dedicated to making your life easier with the latest technologies, and our MVB Bank professionals value your trust. So step out of the banking world as you know it and discover convenient, peace-of-mind banking and a rewarding visit every time. MVB Bank, your most valuable bank. MVBbanking.com, member FDIC.
2-2 is driven up in the air towards right field. Brandon Miller backing up will make the catch. It'll be deep enough for a sac fly. That's going to score Walker Gorley. Barnes moves to third, and it's now a 1-0 West Virginia lead.
Mesa gives chase on it, and he can't come up with it. Hits against the wall. Diaz is in standing, as is Gorley, as Herrera. A 2 RBI double gives West Virginia a 5-0 lead.
West Virginia Power Baseball on Charleston's ESPN Radio 104.5 FM and 1490. Or go to 58WCHS.com and click the Power Baseball button.
Temperatures are rising, so keep the heat outside and the cool inside this year. With help from Rock Branch Mechanical, now is the time to have your home or business cooling system checked. Is it at peak efficiency? Is it even working? Don't wait till it's over 90 degrees outside. Call Rock Branch Mechanical today for a spring maintenance check. Those energy bills will be lower and you'll stay cooler. Call 304-755-0373. Rock Branch Mechanical. Solid as a rock.
Hunting and fishing on the radio every Saturday on 58 WCHS.
Join me this weekend and we'll focus in on the activities surrounding the 2013 National Boy Scout Jamboree going on right now at the Bechtel Summit Reserve in Fayette County. This place is a young outdoorsman's dream come true. Hope you'll join us on Saturday morning. We'll talk more about it.
West Virginia Outdoors with Chris Lawrence, Saturdays at 7:06 on 58 WCHS, the voice of Charleston.
The name of this program is called Ask the Expert. The name of the radio station is 58 WCHS, the voice of Charleston. Today, our dentist is Dr. Jeannie K. Bailey, and Dr. Bailey treats a lot of different things. If you want to go to her webpage and take a look, I would recommend it because there is a lot of good resources on here. Everything from talk about porcelain veneers all the way to non-metal fillings, teeth whitening. You do a lot of teeth whitening over there, do you?
Well, yes, and actually my practice has changed now because we are making a new web page and it will only have sleep and TMD because my practice now is limited to just sleep and TMD. Now, the patients I had before were doing cleanings, making sure they stay healthy that way, but now my practice and what I do is just sleep and TMD.
So I'm to assume from that you're getting a lot of people that are having issues with that you can help.
Yes, and I don't know what was going on this week. I just had really difficult patients come in, which is my knack, and that's what I'm capable of doing. But this just seemed like, things come in waves. So this was the hard patient week.
Have you ever seen that? Is it like that every year? Do things get worse with these kind of sleep disorders and the TMD things in the summer? Or is there any different time of year?
The summer is a time that it picks up just a little bit, which is different from most practices, but people who have pain and are planning vacation, they want to go on vacation. Can you hurry up and get me out of pain so I can go have a good vacation? And I say, well, when are you going? Well, day after tomorrow. And I'm like, okay, I can walk on water, but only ankle deep. So, but that really puts a hurry on the treatment because they're going on vacation.
Well, do some of these people, we've talked about treating it with splints, oral appliances, medication, things like that. Did it ever get bad enough that they need surgery?
Yes, and I try everything I can to keep from people having surgery because I try everything possible, but there is a very small percentage of patients that will have to have surgery. Like if you've torn the meniscus in your knee, you have to have knee surgery. Well, sometimes when those ligaments tear so much and that piece of cartilage won't stay in place, you do have to have surgery. But I have very, very few patients who go for surgery.
This thing that we mentioned earlier about people opening up their mouth too wide on this, that just kind of fascinates me, and it makes me think of like wrapping your mouth around a big ear of corn and then wondering why you ever did that for. But I guess the first thing is people want to know if there's some way that they can prevent this problem. You've said earlier in the show that some of it is, by user standards, not preventable. If it came when you were being born, I don't think there's too much you could do about that. But are there any other things that you could do to prevent this or ease it somewhat?
Well, and actually, if parents see, you can prevent when they're born, when a child has like a sideways posture, go to a physical therapist early on with these children, or go to a chiropractor, someone who's very skilled in this. Now, I work with a guy named Dr. Mario Roccabato, and he's coming to West Virginia for a class. He will be teaching here, but he is a specialist from Chile, Santiago, so he treats babies when they come out, and there are people in the United States that do this. So when these children come out and they have a posture problem, correct it early. Now, if you're older, like us, you can still work on that posture and go to a physical therapist, a massage therapist, or a chiropractor, and that would really, really help in the preventive end.
What kind of bad posture could cause your jaw to be, cause TMD?
Well, some people have scoliosis. I mean, you've heard that term where there's a curve in the spine, or they have a kyphosis. Now, a kyphosis is a hump, like a Dallinger hump in the back of the neck. So those people are very prone to having dysfunction happen in all of the muscles and the nerves and the bones. So that's the ones that need treatment.
I have a little touch of that scoliosis diagnosed as a kid myself. It's not very bad, fortunately, but I understand what you're talking about because you kind of tense up. When something's wrong with your body somewhere, you tense up, don't you, in other places?
Yes, you do. And I always watch people walk. So people who have a neck problem, they have a tendency to walk on their toes. And people who have a lower lumbar problem, they kind of drive their heels into the ground. So we were at a show the other day, and my children were with me, and I always quiz my children, are they a cervical patient or are they a lumbar patient? And all the other kids that were with us, they were going, what's she talking about? But my children, they know now because they listen to me all the time. And we always watch, and if somebody's really walking on their toes, oh, that's a cervical patient. That means neck.
Mm-hmm. How do you feel as a dentist and as someone who specializes in TMD, how do you feel about chewing gum?
Chewing gum is great. It's just limited. And people who have a lot of pain from their jaw joint or have the headache, I tell them, don't chew chewing gum. And they know they can't. Now, they can suck it. They'll put it in their mouth and roll it around, but it hurts too bad to chew. So most of my TMD patients, they just don't overwork their jaw until they heal up.
Is there anything else along that line that we should know about, things that we should avoid doing or eating?
Well, some people bite on their fingernails, and it's like a little mini concussion to that jaw joint when you're chewing on anything like a pencil or a pen. So biting something like that is really not a good thing. And eating hard stuff. For my TMD patients, if they're in an acute phase, like they're dying of pain, for the first 10 days, we eat soft foods. And it's like, even though pizza is soft, it takes a lot of effort to chew mozzarella cheese. So
it sure does. If you have those big crusts, too, those things can really chew forever on those. Are there anything else? Is there anything that you can do besides fixing it? Is there anything you can do for a patient to help prevent it in terms of exercising or anything?
Yes, exercises are very good, and there's special ones to do, and you have to be instructed on it because you can actually do damage. So if it hurts, you shouldn't do it. That's the number one rule. So we have opening exercises where people put so many fingers in their mouth and kind of stretch their jaw, but I have to special instructions go with that. It's not for the average person just to say, oh, well, I'm going to stretch my jaw, because actually you could hurt more ligaments. Mm-hmm. So there are special instructions, but you kind of have to be guided by someone who knows what they're doing.
Sometimes when I go for regular dental exams, they stretch my jaw apart to get x-rays and stuff like that. That hurts me. Is that bad?
Well, if it hurts, it is bad.
Uh-huh.
So you have to be very, very careful doing that. And a lot of dentists out there who are doing fillings, they always know if the patient says, I can't stay open too long, they have mouth props, something that you can rest your teeth on to kind of prevent those muscle spasms from occurring.
Uh-huh.
Then we use anti-inflammatories. When you have somebody open for a long time and everything gets inflamed, we do anti-inflammatories.
You ever heard of anyone hurting their teeth or their jaw while brushing their teeth?
Yes, I have. Mm-hmm. Yes, especially, if you give that sudden gag, that tenses the muscles real, that's a bad one. So, or over opening.
It's 9:55 here on Ask the Expert. Today, our guest is Dr. Jeannie K. Bailey. And Dr. Bailey specializes in, is leaning toward, one of these specialties is the TMD, which sometimes is mistakenly called TMJ, right? But we all have TMJ. That's the joint itself. You've explained to us what TMD does and causes. So if you feel like that maybe that's something that's happening with you, why don't you give Dr. Jeannie K. Bailey a call at 757-7428. That's 304-757-7428. We're going to come back and wrap up this show after this break on 58 WCHS, the voice of Charleston.
Charleston's home for Cincinnati Reds baseball since before the days of the Big Red Machine. The home of the Reds is the voice of Charleston, 58 WCHS.
It's the ultimate inventory clearance. It's Pew Furniture's store-wide blowout and loading dock sale. Every year, we round up and mark down all clearance furniture, discontinued or scratch and dent, one-of-a-kind items, and unclaimed layaways. We mark them down, way down. Many items will sell for nickels on the dollar.
But there's guaranteed savings store-wide on our solid wood bedrooms, our huge selection of dining tables and chairs, and hundreds of handcrafted sofa groups. Only the prices are lower, not the quality.
All of our sleeper sofas come with premium innerspring mattresses for maximum comfort, and they're sale priced as low as $4.99. Solid oak pub table with 2 bar stools, blowout priced for $2.49. Serta Perfect Sleeper queen mattress for $2.97. Nobody has a better deal on Serta Perfect Sleeper.
We're open 7 days a week. Pew Furniture Warehouse Showrooms, 1320 Smith Street in Charleston's Furniture District. All prices met at pewfurniture.net.
We're back on Ask the Expert on 58 WCHS, the voice of Charleston. So you have a cow named Possum, huh?
Yes, we named it after my buddy who thought a possum was asleep in his driveway, and he picked it up, bit him in the hand, bit him in the face, had to take rabies. So I thought, what a tribute. We'll just name this thing Possum after him.
That is another part of your life besides being in dentistry that fascinates me, and that is that you're involved with agriculture, and you're going to be out at the Putnam County Fair.
Yes, and tonight is the auction. We start at 6 o'clock, and if anyone would like to come that's a buyer and support 4-H, that would be lovely. We have dinner provided, and if you would like to come and support the 4-H and the FFA program, that would be wonderful.
What kind of things will they be buying, or would they have the opportunity to buy?
We first start off with the rabbits, and we have goats, we have sheep, and we have a special lamb project. Special lamb project is where an FFA or a 4-H'er partners with a special needs child. I always buy one. I have for 30 years. I love it. Then we have cows. We have the little girl cows and little boy cows, the heifers and the market steer. And then we have the big ones that weigh 1,300 pounds. So we have a lot of variety tonight.
And as I keep telling my wife, don't touch the cows because cows get they have their own personal space they need.
Well, some yes and some no. And the one that I'm calling Possum, he has his own personal space. If he doesn't want to do, he actually lays down and closes his eyes and pretends like you're not there. And I hope he doesn't do that in the ring tonight.
So if you see Possum out there with his eyes closed, he's going, in his mind, he's going, they can't see me now.
I've never had a cow lay down and shut its eyes and just say, maybe they'll go away.
Dr. Jeannie K. Bailey here with us this morning. Thank you for joining us today. It's been a pleasure.
Thank you so much. I've had a great time.
If you want to call the office of Dr. Jeannie K. Bailey, it's 304-757-7428. That's 757-7428. Toll free, 877-757-7428. That'll do it for this morning's Ask the Expert on 58 WCHS, the voice of Charleston. We'll have news coming up next at 10, and then at 10:06, it's Metro News Talk Line. Have a great day, everybody.
It's 10 o'clock, WCHS AM.